Welcome back to this week podcast of Taking Charge of My Cancer. And I have a really fun guest today. This is Nicole Scarpino. Nicole is a physical therapy student from Nova Southeastern University who graduates in May of this year. She graduated from the University of Florida with a degree in psychology with a focus on behavioral and cognitive neuroscience. She's also an avid equestrian, competing internationally in the sport of dressage. So, Nicole, thank you for doing this with me.
No problem. Good to be here.
Yes, absolutely. So, again, I just kind of like told her last week, hey, by the way, we're doing this podcast on Monday morning, and here we are. So, can you tell us a little bit about your journey into physical therapy and what led you choose an oncology setting for your internship?
So to get into physical therapy, riding horses, you have a lot of injuries to yourself. And also you see a lot of friends go through a lot of injuries. So just kind of going through my own rehab process for all of my multiple injuries, concussions, hip surgery, really got me interested in physical therapy. And then I've also had some close friends who've had brain injuries, spinal cord injuries. Seeing them kind of go through their rehab process is really what inspired me to get into physical therapy. And then choosing my rotations, there was an oncology option, which I thought was interesting because we don't really learn a lot about it in school. So I thought it would be an interesting challenge and a good way to really learn something new to just add more to my knowledge base.
Gotcha. And how about horses? How did you get involved with horses?
So I've been riding since I was very small. My mom had horses growing up, so it's just kind of from a very, very young age, I've been riding horses. So that's been a big part of my life.
Excellent. That's amazing. Do you have any personal experience or inspirations that drew you to oncology rehab specifically?
So my dad's side of the family, there's several people on his side of the family who've had breast cancer, and different breast cancer stories, things like that. So that was definitely also a bit of an interest of just kind of having that family component as well.
Okay. And if you want to just tell the audience, what does a typical day look like you in this oncology internship?
So I normally get here earlier before we start to see patients just to chart review, go through the different doctor's notes, whether it's medical oncology, surgeon's notes, radiation notes. And then we start seeing patients normally around 7, and we end closer to like 4 o'clock. So throughout the day, seeing lots of different patients from breast cancer, pre-surgery, post-surgery, going through radiation, going through chemo. We also see quite a few head and neck cancer patients as well. So just every day looks a little different, which is also kind of the fun part of it as well.
How do you feel in the beginning with these days? Like, I know it's overwhelming. And I always tell my students if this is not overwhelming, in the first few weeks and something is going on here. But what were you thinking like on the first week, like Monday morning, boom, we start with a press conference and tumor board. So what were your thoughts?
It's definitely a lot of information all at once, and it's a lot of new information all at
Mhm.
once. So just kind of figuring out the routine and the program, I think, is the biggest challenge, especially in the beginning. And then just kind of understanding a little bit more about how the world of oncology works and all the different moving pieces and components. And then once I started to figure that out, it made everything a bit easier.
Okay. And I know we kind of like touched base on this and the question before, but what is some of the patients on condition that you are mostly common working with right now?
A lot of breast cancer patients, and then a lot of head and neck cancer patients, whether they're going through surgery or chemo or radiation or multiple treatments. And then occasionally some other different types, whether it's brain or TMJ or something like that.
Okay. And then what surprised you the most about working with cancer patients from a PT perspective?
I think from a PT perspective, when you originally learn about some oncology patients, there's a lot of things where you're maybe a little bit afraid to really like get in there, do manual work, a lot of treatment. It's kind of like, oh, how do I handle and treat this situation and make sure that you push the patient enough is kind of what I've also learned too, is like really pushing the patient, even from like a physical activity standpoint, because I think everyone who has a general idea of cancer or chemo, you just think of somebody who's sick, tired, having all these negative side effects from their treatments, and thinking, okay, how much can you actually do with that patient? How much actually exercise can you really push them to do? So I think that was definitely something new.
Okay. Um, how about what are some clinical skills or knowledge areas that you found especially important in this setting?
From clinical skills standpoint, a lot of like manual therapy for more of the lymphedema treatments and all of the different types of manual therapies you can do. And there's different techniques for absolutely everything. So kind of trying to learn all of those and when to apply a lot of the different clinical skills, I think was definitely something to learn. And then the knowledge, as far as knowledge areas, definitely starting to learn more about like, okay, medical oncology, what are some of the different common chemo drugs? What are the side effects? What do we need to look for? Same thing with like radiation. What are the side effects from all these different treatments that you can then address in physical therapy? And I think some of the how we address it is not necessarily anything crazy. It's like exercise, range of motion, soft tissue work. So it is stuff that we learn in school, but it's just figuring out when to apply what and how to apply it.
Exactly. I usually tell my students, when they say, oh, this is an oncology setting, and that was my thought as well before, because before doing this, I was doing a lot of orthopedics before I became an oncology specialist. And I just say, this is your typical orthopedic patient with a lot of the flavor of the cancer treatments, right?
Yeah.
So whatever that implies, but it's your same neck, your same shoulder, your same spine, if it's any metastasis. So you just, again, have to know those other things that you just mentioned, that you gotta take in consideration your treatment for any secondary effects that happen due to chemo, radiation, or even our post-surgicals, etc. So very good. How do you balance compassion and professionalism when working with patients who may be facing serious or terminal diagnoses?
I think the biggest thing from a compassion standpoint is just listening to the patients. They are going through a lot. They get a lot of information all at once. So sometimes just being a sounding board and helping them kind of organize all the information in their head is a big one. And then still kind of being professional throughout that. Like sometimes, as far as professionalism, you might have to say, okay, that might be a conversation you need to have with this doctor to address those concerns. And then it's a lot, like I said, a lot of like listening to their questions and concerns, but especially when it comes to more terminal diagnoses, it's switching the mindset of, okay, what's important to that particular patient in their everyday life? What are the things they like to do and want to continue doing, regardless of their treatments, and trying to focus more on that and quality of life rather than trying to sit there and be like, oh, we're going to cure this or we're going to completely change this. It's more shifting that mentality for quality of life and what's really important to them.
Perfect. Yeah. And again, it's tough, we get teary eyes. It is hard not to. And it's totally okay, right? It's totally okay as long as you contain yourself. And sometimes it's hard because we have, very sad cases. But at the same time, it's all about that. It's about quality of life. It's about day to day, right? Like, I always tell my patients, with bad prognosis, like, we don't know when it's time for us to go. We can be super healthy today and tomorrow be in an accident and then die. So you just never know. So again, it's all about quality of life, right? And it is not so much like, well, because you have, used to be, I remember back then years ago when I was kind of facing some of the cancer or somebody with cancer and I didn't have the knowledge I have now. Everything was about, oh, don't do anything, just take it easy. Everybody does everything for you, don't make any efforts. And now it's not like that at all. We want them to continue doing whatever they do. If they want to be walking or they want to do hiking, or even if they want to go and do running or whatever they do, just as simple as taking care of the grandkids or taking care of the kids or working, or just manage to be doing whatever they do at home, is the most important part of it. So we want them, the more they do their normal life, the more active they are, the better off they're gonna come out of this other cancer treatment type of complications that can create. Was one thing that you learned during your internship that you think all PTA students should know about oncology rehab?
I think it's a little bit what you said earlier about it is still a lot of ortho, but just with a slightly different flavor of oncology. And I think, especially if you have patients who are going through chemo or radiation, there's so much that you can do in the clinic with the patient, even if you're not like an oncology specialist. Like for a chemo, if they're going through chemo, doing a high intensity training, interval training program, any PT student can be able to kind of do those things, addressing range of motion, ortho, all of those things. Any PT student can do that and help a patient through those things. So I think it's not being nervous or timid to kind of take on and treat those patients, because you don't necessarily have to be an oncology specialist to provide some help and quality of life to some of these patients.
Perfect. What have been some of the biggest challenges that you have encountered during this internship?
It's definitely a lot of information. Is probably the first one. It's a lot of information to figure out where your feet are on the ground. And then after that, I think the biggest challenge is accepting the things that you know you can't change and you can't make better for patients. Like you can't control their diagnosis, you can't control how they react to treatment. And then knowing like what you can change and what impact you can have. I think that's probably the biggest challenge of being able to compartmentalize that into your brain of like, this is what we can impact. So that's what we need to focus on, and not getting kind of stuck on the things you can't change or no one can change.
Perfect. And what advice will you give to another physical therapy student considering a clinical in oncology rehab?
I would definitely tell them to take that rotation, even if it seems a bit like overwhelming at first, or even if you're looking at it going, I have no clue about anything related to oncology, just to do it anyways, because you'll learn a lot. It's definitely a good experience.
Excellent. Well, Nicole, you've been doing fantastic. You're a keeper. That's why we're keeping you in the system. I really appreciate everything that you have done here in the clinic. Again, we still have a couple of weeks to go. But thank you again for just being part of the show as well.
No problem.
All right. See you later.